Good evening. I'm Francine Maxwell, the NAACP San Diego branch president, and I want to welcome you to this important event. I really appreciate you taking time out of your busy schedule so that we can discuss the most precious thing, which is our young people, and the fact that some have already started school and some will be starting school. The mission of the NAACP San Diego branch is to equip our community with resources that help you thrive and survive during this unprecedented pandemic time. I want to give a shout out and appreciation to Dr. Robinson, our health committee chair, our educational chair, Mrs. Hamilton, and all the panelists for your just willingness to come and share with the people. Educational leaders that are here, the doctors, really appreciate you for taking time out of your busy schedule. Now, I'm going to turn this over to Dr. Warren and Dr. Leonard J. Thompson III to do the moderation. Have a wonderful event.
Thank you so much. Dr. Warren, how are you doing this evening?
Good evening. I'm totally blessed. I always say there are no bad days above ground. And so we all are here. I'm excited that we could contribute the time we would normally use from the desk of the editor to this important event. You and I, Dr. Thompson, are certainly supportive, and we certainly appreciate the leadership that Dr. Robinson has given us, both in terms of the NAACP and Black Men and Women United. So I would like to decrease that. This might increase in terms of hearing those, and I would encourage those who are listening, if you have an opportunity, if there's someone you know that has not made a decision here, or there are young people that can be impacted, perhaps you could give them a call and encourage them to be on this Zoom town hall meeting, which will be for the next 2 hours.
All right, Dr. Warren, we have an outstanding group of panelists on this evening. Dr. Vernon Moore is with us. Dr. Sayon is with us. Dr. Naomi Lawrence Reed is with us. Dr. Susan Afalo is with us, and Dr. Jerome Robinson. We're all here to give out great information, and we're just going to start off right with the school district person. Dr. Moore, would you basically start us off with what is going on in the district and how you are preparing for the students that are coming to you at this moment?
Dr. Thompson, thank you very much. I am Vernon Moore. I'm the Chief of Educational Equity and Support Services in the Sweetwater Union High School District. And Dr. Thompson, you indicated, what are we doing to prepare for students that will be soon coming to our schools? And since July 21st, Sweetwater Union High School District has been open. We are 100% in person, and we've had our student body reporting to all 23 of our campuses. And you know, this, and I'm sure that the medical doctors on this great presentation, this great panel, will have plenty to say about this. But we have had COVID-19 cases reporting to our schools. We have a dashboard. We have a dashboard that's updated every day with new cases. And the bottom line is really this, is that certainly if you have a person in your household that's 12 years or older, they are eligible to get a vaccine. And barring some significant medical reasons that you would be discussing with your medical provider, we have been encouraging folks to get that vaccine, because it is over time now been proven to be effective. The governor of California just indicated that folks who work in schools, teachers, administrators, other staff members, that they will need to get vaccinated or submit to COVID-19 testing on a weekly basis. And so those are that's the primary thing. If you've got a student or person that's coming to school and they're eligible for a vaccine, I strongly encourage them to get it, and it's absolutely recommended. Beyond that, we're at full masking, certainly while indoors in our buildings when students are present. So wearing masks has been proven to be an effective deterrent. And so at our school level, unless there's some kind of medical exemption, all of our students and teachers and staff members at our schools are wearing masks indoors. Even then, we still have COVID-19 cases that are presenting on our campuses. And we follow the county guidelines and protocols to mitigate the spread of the virus, which includes having folks isolate and quarantine and all of the things that our medical professionals have recommended for us to do to make sure that we're keeping our students safe. And there's one more thing that I'll bring up now, and I'm sure it'll come up later, is there's also a mental health aspect to this, because as students and staff are identified and potentially going through the possibility of either having or being exposed to COVID, sometimes there's anxiety and anxiousness and some negative feelings that have occurred. And so our one of our primary thrusts is to make sure that we provide our students and staff with the mental health support that they need to be successful in our schools. But we are off and running. 37,000 students have been coming to Sweetwater schools for almost 4 weeks now, and we're in the thick of it. We are ramping up COVID-19 testing throughout our district and really pushing our community to get vaccinated. So thank you for this opportunity, Dr. Thompson, and I look forward to hearing the discussion on the panel.
Well, thank you very much, Dr. Moore, for coming in and being a part of this. You are on the front line of working with our schools, and there's going to be a lot of questions that I know that we're going to be having come up in the chat about how we're going to keep children safe. Next, I want to bring up Dr. Sayon, because I believe that he will be able to share, again, some additional information with us. And, you know, I'm excited about your presentation, sir. But when I tell you, Dr. Susan Afalo and Dr. Naomi, if y'all ready, y'all better get ready for all of these doctors, because they're going to bring the juice tonight. Trust me. Here we go, Dr. Sayon.
Hi, everyone. Thank you for letting me crash this party and meeting. I love that you're in a studio and giving us this opportunity to talk directly to you all. Before going forward, sometimes I find personally it's always helpful to look backwards a little bit, right? And so I'm just going to look at this information about deaths. This is all deaths in the US for the last couple of years. I still, and many of you may know people, you know, I still have a lot of good friends from high school or whatever, you know, who say, oh, well, maybe they're miscounting deaths. Maybe this isn't as bad as people say. Maybe it's not real, you know, or if it is, how real is it? And so I just want to show you that when you look at all deaths recorded on the CDC's websites and their reports, you see in 2017, 2.8 million, 2018, still 2.8 million, 2019, 2.8 million, a little bit higher each year. 2020, 3.35 million, right? So you see a 500,000 increase in deaths, and that's all deaths. And we know that at least slightly over 300,000 of those are COVID deaths. And that's why last year, when we look at that data, COVID was the third leading cause of death in America. But, you know, like everything that we talk about and every health impact and many other societal things, that things unfortunately are never distributed equally. And probably no surprise, but it did impact Black and brown people of color disproportionately and more. Right. So now I just want to talk about life expectancy. So this is really, if you're born today, how long are you expected to live based on your race or ethnicity? And so to begin with, Black Americans already had the lowest life expectancy. And if you look at these pictures, like I said, Black and brown people were affected the most by COVID-19. So they had the biggest drops or hits to their life expectancy as compared to white Americans, for example. I don't see Asians on here, but you can see, that non-Hispanic Blacks right here started at 74.7, already lower than these other two groups, when they dropped down to 71.8. So this is lower than World War II life expectancy, rates around that time. And we've gone backwards. And unfortunately, people of color continue to be affected the most. We know, and there's a lot of pictures here, I get it, I'm sorry about that, but all you have to know, or all I'm trying to make the point that I'm trying to make is that we know that it's one thing that cases are distributed unequally, right? And that you can look here on the top figure and you see, compared to whites, for example, Blacks, it's slightly more, and yes, the case rate is slightly higher. But then when you look here at hospitalization rates or death rates, you see whites compared to Black, the gap is much bigger, right? And it's almost double actually it's more than double, sorry, for hospitalization, and it's almost double for deaths. So that's because as a population, we know that certain groups unfortunately have more medical conditions to begin with. So more underlying conditions means you're more at risk for hospitalizations, for deaths, for severe outcomes from COVID-19. So that's why it's even more important that we work hard to prevent the cases in the beginning to begin with, so that we're not disproportionately affected. And really the bottom line for me is that whether or not we were infected with COVID-19 to date, our lives and our livelihoods were all affected by COVID-19, right? Like Mr. Moore just said, right? Our mental health has been affected. Our school children have been affected. Many of our kids, and as a parent of two kids, both, under 12, so they can't be vaccinated, right? They were affected. Their schools, et cetera, were affected. We know that people of color were more likely to be essential workers on the front line affected like that. We know that mental health visits amongst kids have gone up. And we know that our economy, our jobs, et cetera, have been affected. And the best tool that we have, the best public health tool by far, is vaccines. And that's the best tool to not only get back to normal, but also stay normal and not go backwards, because right now we are going backwards. And so this is, just the last couple of weeks, when you look at the case rates by the way that the CDC calculates them, you see that we've gone from yellow, which is moderate transmission, to orange, substantial transmission. And now the last few weeks, we are in the red. We have high transmission in San Diego County. And we know that that transmission can vary by who you're talking about and who's affected, and really those who are unvaccinated most affected. And we know what's driving those increases, really due to the Delta variant, the newest kid on the block, right? It reminds me, I went to college when Kanye was at his prime, and the Stronger song, right? It's harder, faster, stronger, better. Hopefully I got the words right, but this is not the same COVID-19 that we had in 2019 that the world started seeing back then in China, right? This is not the same COVID-19 that we saw in 2020. This is not the same COVID-19 that we saw in February when we had the last surge. This is a worse type of COVID-19. This is more contagious, much more infectious. So you see here, this is the original one. One person could infect about 2.5 people. With the Alpha strain, or the UK variant, the B117, whatever you want to call it. I know it had different names, but all the same thing. One person would affect 4 to 5 people. This one, the Delta variant, can affect 5 to 8 people. And some estimates are even higher. And it shows that even those who are vaccinated, even though it's less likely to get infected, they still can get infected. People are getting infected, they're getting more virus earlier on, and they're often becoming infected earlier on after an exposure. It's still not as bad as something like measles, right? But it is in terms of contagiousness, but it is definitely very, very contagious. And that's what's running through our country and really the world right now, and making up the majority of cases that we've been seeing recently. And it's affecting everyone. And I just wanted to show, when we look at our data, we update this weekly, of the cases that we're able to get that genetic sequences of and study further, we see that almost 6% of our Delta cases of the 200 that we're able to get that genetic analysis on are in African Americans in San Diego County. So we know that's a high proportion, given that the population of African Americans in San Diego County is not that high to begin with, right? Compared to like when I used to live in New York, for example. And then really, you have to understand that vaccines are the best tool that we have. And unfortunately, not everyone is eligible for the vaccine, which is what part of the reason we're talking today. But if you are eligible, you really need to consider getting that vaccine, because as you see here, if you are fully vaccinated, when we look at our data from March, right, the majority and the overwhelming majority of cases and hospitalizations and deaths are in those who are not fully vaccinated. Right. So even if you were fully vaccinated and you get COVID-19, and the vaccines are a little less effective against the Delta variant, that is a fact, but they are still extremely effective against severe COVID, or the type of, the result of you getting in, the COVID reaction that your body has that would lead you to getting into the hospital or dying, getting into a funeral home. So really the best thing to prevent you from getting hospitalized or dying from COVID is to get vaccinated. And really with the combination of something we'll talk about later called monoclonal antibodies, with early treatment with monoclonal antibodies and vaccines, we should be able to prevent most COVID hospitalizations and deaths. And so we can do better, and we will do better as more people are getting vaccinated. That's why we are doing better than other states that are less vaccinated, than other countries that are less vaccinated. If I was still in my birth country of Nigeria, I wouldn't even have access to the vaccine right now, because less than 2% of people are vaccinated in Nigeria right now, when you look at the some of the vaccine statistics. Right. And it's important to know that vaccines are the best tool that we have, but it's not the only tool we have. I love that hand washing song that you played, Dr. Thompson, in the beginning. And really, we have to think about this as risk, right? As a continuum. There's lower risk activities and there's higher risk activities, but it's hard, and you can never say something is absolutely zero risk or something is 100% risk. There's a lot of in between. And when we talk about students going back to school, of course they're getting into classrooms in close proximity, indoors for extended period of times. And then when you talk about kids like the ages of my kids, they're not able to get vaccinated while others are able to get vaccinated. Thankfully, as just shared earlier, the teachers are going to be required to either show, and staff in general in school are going to be required to show proof of vaccination status or submit themselves for weekly testing. So that will help. That will hopefully help get more people to get vaccinated. And then for those people who are not to still choose not to get vaccinated, it'll make sure that they're not having COVID symptoms or COVID disease or infection that they can then spread to our children. The other thing I just wanted to say is that you as a parent, right, you have much control over this outside of the school as well, right? And you have control of this with the school too. You can always talk to your school representatives, ask them what are they doing? How are they handling this? How are they preparing themselves? Have they upgraded their ventilation systems? How much are they able to distance kids? They don't have to, but are they able to? Are they able to keep kids kind of together like elementary school kids where, it's kind of the same groups of kids, so you can understand their processes and what they're doing. I guarantee you that all of our public schools and private and charter schools are definitely in tune and are definitely taking measures, but that may vary by a school. And so it's always helpful to understand those processes. And then as a parent, like, for example, my own kids, I do ask my friends if they're vaccinated before I schedule play dates or hangout time with them or their kids and my kids and stuff like that. And you can do that too, right? That's in your ability to do that, and trying to wear face coverings, especially when you're indoors and if you're unvaccinated, although CDC now recommends it for everyone indoors. So why should younger San Diegans get vaccinated? Because our lowest rates of vaccination are actually in those who are the youngest who are still eligible for vaccinations. And right, because if you're an older adult, many of us know other people who've been affected by COVID, who've been hospitalized, maybe even unfortunately passed away. So I think the case is easier to make in older adults when you're talking about 50 and over, but really the under 50 population from 12 to 17 and then 18 to 29 and are less likely to be vaccinated. Although we have made significant gains. But why should younger San Diegans get vaccinated? It's really to protect themselves. It's the safest way to get immunity to the disease. A lot of people only talk about hospitalizations and deaths like I've been doing, but really it's important to know there's a lot of things called long COVID, where you can continue to have these annoying to actually medically significant symptoms for a while after you get the infection. And then there's something called multi-system inflammatory syndrome in children. There's also an adult version, but this is a severe reaction, inflammatory reaction in kids that lands them often in the hospital, actually pretty much always in the hospital. And this is something in kids. I'll talk about this more in a little bit. And then of course, we know that getting younger folks vaccinated is so important to protect our community at large. It's important to protect the people who can't get vaccinated, like those 11 and under, as well as to protect our older adults who may have more underlying medical conditions and be more at risk of severe COVID. Typically, the case rates are highest in younger San Diegans. It's actually the highest in the 20 to 29-year-old age group. They're the most likely to get infected of any age group. And that's because young people move around a lot. They work often with other people, very social, et cetera, or they're social in their personal lives. And so they're interacting with a lot of folks. So, and that's okay. They should be, and they should be doing their jobs, et cetera, but they hopefully folks can also get vaccinated to help protect their communities. And then the last thing is really just, we know that everyone who's fully vaccinated can feel safer doing the things you enjoy. And note, I said safer, not safest. We know that these vaccines are not 100%. They were never guaranteed to be in the beginning, but we know that they are extremely effective. They're much better than we even expected, before they were before the trials, and we were hoping for. So we should be very thankful. And again, even if the chances of getting Delta strain might be a little higher, because the Delta can evade the vaccine to some degree, it can protect you against severe COVID that lands you in the hospital or funeral home. So I would just want to say that, right, we do a lot of things that we know are not 100%, but we know are just much safer and helpful from a risk perspective, right? We put on seatbelts, we put on helmets when you ride your bike, and that won't guarantee that you're not going to die in a crash, but it will definitely help you, right? And with airbags, with seatbelts, with all this technology, we use birth control, because we know that can help your chances of not getting pregnant if you don't want to get pregnant, things like that. So there are things we do, even if they are not 100%. And this is another one of those examples. And just want to talk about multi-inflammatory syndrome, and then I think I'm done. So this is something that affects mainly smaller kids. Like you see the average or median age is in 9-year-olds. Half of the kids are between 5 and 13, and 62% or 6 out of 10 kids affected are Black or brown. So it is disproportionately affecting communities of color. So we have to do everything we can to stop that and prevent that. And the vaccinations is the best way to shield our communities against COVID ravaging through them. So how do you get vaccinated? There's a lot of ways now, right? Thankfully, access is not the issue. You can go to your trusted local pharmacist, you can go to your trusted doctor, you can go to your local community clinic, or you can come to one of our county sites, and you can go on this website and find the closest site near you. But we know that in general, most San Diegans are actually getting vaccinated through their pharmacies or their doctors or clinics over our sites, and that's okay. We know that there's trusted providers, and you should follow who you trust and the medical providers that you trust. But anywhere you go, we're just glad if you go and that you're going. And then also the other thing is that if you have symptoms of COVID-19, whether you are vaccinated or not, it is important to get tested, right? This is the tip of the iceberg, because we know there can be people who don't have symptoms. So this is the people who are easier to identify who have COVID. So please talk to your doctor or community clinic if you need a test, or go to a county site. We still have our Tubman Chavez Community Center. We just put out a press release today. I don't have it in the slide, sorry, but just announcing that we have some new sites that that are going to be going live, if not already. We recently launched SDSU, or reopened SDSU, and many of our public health centers, like where I am at North Central, is open, on a schedule with scheduled appointments as well. And then last thing is just the monoclonal antibodies. So many people just aren't aware of this. If you know anyone who has COVID-19 or who was high risk and exposed to COVID-19, please have them talk to their doctor or call this number on the bottom, because they may be eligible for monoclonal antibodies. These are proteins that are early treatment can help, and the data show these are really good to help prevent severe COVID. So you're supposed to take this when you're not feeling that bad, when you get diagnosed, when you have mild or moderate symptoms, to prevent you from getting hospitalized. If you're already hospitalized, it's too late. This is preventive therapy that you can take right after you get infected. And most people are medically eligible if they're over 12 years old. And that includes and anyone who's over 12 years old and has symptoms and for less than 10 days, or was exposed recently and is at high risk. And one of the definitions that the federal government uses for high risk, that the FDA, is if you're a population that's more significantly impacted by COVID, and that's people of color. So just race, ethnicity alone, and having COVID will make you eligible. So most people will be eligible. Just call this number or email this or talk to your doctor if you have any questions. And then, bottom line is that there's no single prevention strategy that is enough. We have to layer these imperfect strategies on top of each other, kind of like the Swiss cheese model, to really have the best effect. If I can redraw this, I would draw vaccinations as the biggest slice of cheese with the smallest little holes, because that's the best strategy we have, but that's not the only strategy, and not everyone can get vaccinated.
I need to cut you off there because we got others. And I'm sure some of what you're giving, we're going to hear again. And it's okay that we hear it more than once, but I do want us to be able to give the same amount of consideration to our other guests. And we thank you for being here. I think one of the things we want to do is, because we have several other people to hear from, we'd like to do that and then go into the questions, because I'm afraid that once we start the questions and answers, then we will get away from maybe hearing everyone.
Well, one of the things that I want to say, first of all, is that he's given out a lot of information, and you guys can start asking your questions via chat. You can, if you're on Facebook or if you're on the Zoom, you can put your questions in the chat. And then as this is going on, we can answer some of them. Like somebody just asked, what is the name of the medication you just talked about? You know what I'm saying? So whatever, if you could just say that or put it back in the chat, we'll be able to get that out to everybody. So throughout this evening, if there are certain questions that we'll be able to ask while you're doing it, we will do it. But we're going to save all the major questions into the very, very end. If that's all right, Dr. Warren?
That's fine with us.
Yeah.
And I'm really excited as we move forward, because I'd like to next hear from Dr. Lawrence Reed. And as we do this, we're making notes here. So we hope that this approach that we have is going to make a difference. I'm sorry, Dr. Reed. And Dr.
Yeah.
Oh, well, I'm giving them one at a time, because I'm identifying Dr. Reed. She's next. We know we're going to hear from the eminent, illustrious Dr. Follow. And I'm always excited to hear anything that she has to say, because she works at this 7 days a week, 324, 360, 724.
And the cool thing about them, Dr. Warren, is that they said we're going to come on as a duet.
That's true.
Yeah.
And so, I mean, I mentioned Dr. Lawrence Reed first, but Dr. Follow, I was trying not to be alphabetical. Okay. So between the two of you, it's open. I want you to go forth, and we're all ears, and we're excited.
Great. Thank you, Dr. Warren. Dr. Naomi and I are here as a tag team, and we're going to do this. We're bringing the women's power together here. We have ourselves, and she will speak in just a moment, but Dr. Naomi is a pediatrician, and I represent the family medicine doc, which is from 0 to death. So that's pretty much covers everyone that's in the audience and any questions you may have. So I think what we want to do is really have a discussion. And what we wanted to start off with, since both of us are in the primary care arena where we see these young children and their families, and we wanted to talk a little bit about us being trusted messengers and the reason why families have trusted us up to this point, pediatricians for their children and family medicine doctors to take care of their children and their families. So Dr. Naomi, you've been at this for quite a while, and I've been at it for 30 plus years. I won't even go into that. We have been on the front lines of taking care of the young children, and it is our priority to make sure that they're safe. So what are some of the things that we need to talk about? Because we've covered everything in terms of children and how we take care of them.
Right. Well, thank you for having me. It's an honor to be here and to help educate as many people as possible and to come on the tails of Dr. Seon's presentation, which was excellent. I am a practicing pediatrician in San Diego and in Southern California. And, I've been here for over 7 years now. Pediatricians in our world, kids are the most important to us, obviously. And we see them from newborn. We see them as soon as they're born. And if they are born not breathing, we are the ones to save them, to bring them and sometimes back to life. That starts at newborn and goes to 18 years old. And we see children for everything, for stitches, for broken bones, for cancer, for the worst things. And children are our priority always. And of course, a large part of what we do is vaccinations. Period. Even before COVID, vaccines were a huge part of what we do in vaccine education. So now here we are in August of 2021, we now have a vaccine that is safe for children 12 and up at this present time. Every indication currently shows that this is completely safe and, as Dr. Seon said, very effective for the prevention of COVID-19. We are in the business of children here in pediatrics always, and we are trusted by parents and by caregivers for all other parts of a child's health. And so at this point, to all of our listeners and viewers who have a child in their home who is older than 12 years old, we obviously give babies vaccines and 4-year-olds vaccines. We give 12-year-olds vaccines. We give them the Tdap shot, which prevents tetanus and pertussis, the coughing, whooping cough, and diphtheria, which is a form of diarrhea. We give them a vaccine at 12 years old that prevents meningitis. I think most people are familiar with meningitis because it can kill children. It can kill people very quickly. And we give them that vaccine at 12 years old. And now we are using very similar technology. This COVID vaccine is very similar in that way, in providing immunity for children to prevent this life-altering virus that we know has the potential to kill children and to make them very, very, very sick. And so this is just a continuation of what we do. And I just want to again and again implore all of the listeners and viewers that if you have a child that is over 12 years old in your home, the best thing you can do to prevent them, to protect them, to protect younger children in the home who are younger than 12, and to protect yourself is to vaccinate.
So with that, and thank you for sharing that, obviously we are in the forefront of taking care of them. And I have to say that last week, Wednesday, when we had our health fair, we offered sports physicals, and there were 120 people that came out to get physicals. And I have to admit that I asked every single one that I did a physical on if they were vaccinated. And to my dismay, I was really disappointed to hear that the majority of the young kids that were old enough to get it, 12 and older, and also the young adults coming from Southwest College for their football and soccer physicals were not vaccinated. And by all means, I certainly asked them why. Some of them just said, I'm good, I don't need it. I got a good immune system, the whole shebang. You've heard it all. But I have to admit, the one that bothered me the most was a mom that brought in her child who was 14 and was going to be I believe she was going to be playing soccer and doing some cheerleading, and mom was vaccinated. but the child was not. And I asked the child, I said, are you vaccinated? And she said, no. And then the mom chimed in and said, well, I just want to wait. And I asked her, I said, well, what are you waiting on? You know, because if you you protected yourself and got vaccinated, why on earth wouldn't you want to protect your child? And all the risks are there. So she didn't really have a good answer, but that was not the time to really go into it because we had a long line outside for physicals that were waiting an hour. But we definitely need to educate the parents that, you know, if you're going to take the time to vaccinate yourself and keep yourself safe, you have to keep your children safe. Number one, you did the right thing by keeping your household safe by vaccinating, but your 12-year-olds and older also need to be vaccinated to protect the ones that are younger. So I was a little disappointed in that, but that is the trend. And the majority of the people that came for physicals last week were Black and brown students. So that is why we see the lowest vaccination rates and the highest rates of infection is because we have the mentality of the population that we serve is just that. I'm good. They believe all the hype that they've had, you know, on social media. They ask their friends instead of asking trusted messengers that know a little more information than them. And therefore now we're at risk for higher incidences with our pediatric population. So are you running into some of those scenarios where you're running into some young adults that are just not ready to get vaccinated?
Absolutely. Absolutely. I mean, that is the mantra in the pediatrics clinics right now, is that same thing. You know, we're waiting. We want to see. This is a virus that at this point is looking for the unvaccinated. It is roaming and looking for the unvaccinated, and that is its current target. And you know, I've told parents, you know, you can wait, but you may wait too late. You know, we don't want to have regrets at all. The vaccine and the waiting, and you know, people saying, well, we don't know what's in it, and those are kind of the two. But it turns out we do actually know what's in it. We know exactly what's in it. And again, we are trusted to give you medication. We are trusted to give you chemotherapy. We are trusted with all of the other things that we advise and give and do for our patients. I say the medical population at large, but particularly pediatricians. We calculate doses to many decimal points in children. We do want to know exactly their weight. We are very careful, and so this is one of the safest things that we can do. And quite frankly, you know, we are already seeing the long-term effects of COVID infection. And as much as I try to describe, you know, the pain that I see in parents who have an infected child, a child who has to be admitted or potentially in the ICU or potentially intubated with a tube down their throat, those children, the pain in those parents is very, very hard to watch. But, you know, as much as I do try to tell parents, you know, I am seeing a lot of those rationales that they're using in terms of waiting, which I don't know if they're saying really just to pacify me, as I am sitting there in the clinic looking straight at them. Whether they have any intention, I hope that they are continuing to get the right information from medical professionals rather than social media and blogs and posts and, you know, friends and family potentially who are spreading disinformation. Just a side note, personally, I visited an aunt. I live here in San Diego, but I was visiting an aunt in Alabama in July. Hadn't seen her in some time. We'd both been vaccinated and tested. So I really wanted to see her and spend some time. She's in her 70s and she does not live far from Tuskegee, Alabama. And so we took a day trip to Tuskegee, and the museum on the campus happened to be open. And there's a floor of the museum that is dedicated to the experiences of African Americans and their interactions with the medical system. And of course, I'm speaking about the Tuskegee syphilis experiment. And also another half of that museum was dedicated to Henrietta Lacks, who was a woman in Baltimore whose cervical cells were taken without her or her family's knowledge or consent, and ended up being able to develop the HPV vaccine and many, many breakthroughs in science and medicine because of her. And so it was interesting for me to see all of those those things, and potentially one of the roots as to why African American, brown and black and brown populations are so hesitant and avoidant of the U.S. healthcare system, and to see those documents and to see those men and those this woman who are directly affected by it, and then to hear. Fast forward to now, hearing the reasons that people are avoiding the vaccine and bringing up those past times. And of course, it was devastating to see. It is enraging still. This is a very different experience. This is a very, very different time right now. This is a vaccine we are trying to give all people. And that it is not just, there is no tracking device. There are, this is a vaccine that we have been using for months and already are seeing such excellent results from. And so the long-term effects are at this point not a concern because COVID kills and it can kill very, very fast. So that is what we are trying to avoid. But I do understand our hesitancy in terms of our history here in this country. But I also do want to, advise and implore that this is not the same. We are really trying to save lives here, all of us right now, and we can each do our part by getting vaccinated.
So I will say that the people that know me, that's in the audience, know that sometimes I can be a little bit raw and definitely transparent, especially when it comes to our community, because sometimes I just need to wake them up. So depending on the person, I can approach them with kid gloves or I can just get in their face. So when people tell me, I read the room so I don't offend anybody, but people that tell me, they don't know what's in it. And I ask myself, well, you don't even know what's in the McDonald's hamburger you're eating. So why on earth do you need to know what's in this vaccine? You don't know what's in the other vaccines that you've given your children. Why all of a sudden do you need to know what's in this one? So because it was politicized from day one, we are fighting that battle. Because no parent or child would have been asking us what was in this vaccine if we did not have issues that started from the very beginning. So we are playing catch up. The other thing I would just say is, when they say they're waiting, and I ask them, what are they waiting for? They're waiting for, a death sentence to their child so they can, or can you live with the guilt of not getting your child vaccinated in a timely fashion? So, sometimes I'm raw with them, but sometimes that's what gets their attention. Other times I just educate them and say, hey, this is really what's going on. You really need to think about it. You need to pray about it. You need to make the right decisions for yourself and your family. But here are the consequences if you don't get vaccinated. So, we do have to read the room, but not everyone gets to be approached the same way because some people need that hard hammer over their head and some people need to be cajoled along the way. With that, I just want to say that, we have reached close to, this stuff reached close to home. I'm sure everyone in the audience probably has either known someone or a family member that's been infected by or possibly lost a family member. And I'll just say quickly that, yes, as Dr. Sion said, it's not 100% this vaccine. So I have a colleague that was fully vaccinated, actually participated in one of the vaccine trials, went and did something for a patient, a ceremony for a patient, was exposed, did not realize until several days later that he was exposed. And then he ended up coming down with COVID actually after being fully vaccinated, and then had to go ahead and get the monoclonal antibodies to feel better. So if had he not been vaccinated and or even gotten the monoclonals, he may not be. So what I'm saying is that it can affect anyone. Every single one of us, vaccinated or not, or at risk for this Delta variant. As you said, Dr. Naomi, it is searching for the unvaccinated. But in the midst of looking for the unvaccinated, it can certainly affect the vaccinated ones. We can carry it asymptomatically, not knowing it, and then expose someone unvaccinated or a small child to it. So we have to continue doing all the right things to protect our children. We have to wear a mask. I don't care indoors or outdoors. I have not stopped wearing my mask. I don't care what the president said, what the CDC said, what the NIH said. I didn't stop because I knew it was too soon. Our Black and brown community was not ready to take off our masks because we're still poorly vaccinated. So with that, we have to make sure that we are still doing the right things to protect our children. So with that, I want to say, the cases are spiking in children. Thousands of children are being affected each and every day, especially in states that are demanding that you cannot do a mask mandate, in some of the crazy states that, are trying to kill children. So with that, What do we need to do here? I know that we need to make sure, and things have been mentioned, that we need to make sure every single person that is 12 and over get vaccinated, that we need to wear a mask at all time, especially around the younger children who are unable to get vaccinated and the immunocompromised people, whether adults. Dr. Moore said, as he's doing in his school district, that everyone is masked up. Everyone is either showing that they're vaccinated or getting tested. And then we need to try to avoid gatherings. So are there other things that we can do to help protect our young adults who are not able to get vaccinated yet and keep them safe in the schools?
I think you've mentioned so many things. I think the best thing that we can do is lead by example. I think parents of young children need to have discussions with their children. This is, I hope, a once in a lifetime situation. But I certainly, you have mentioned all the things. We're hand washing, we're distancing, we're wearing masks, we're getting vaccinated, we're avoiding large indoor gatherings. We're not going to do that right now. And, the big ceremonies and the things we want to have and the things we want to do that are rites of passage, the birthdays, the weddings, the quinceañeras, all the things. It's not worth the risk right now. We'll get into graduation season soon again. So we're doing all of those things. But Dr. Moore briefly mentioned that the psychiatric aspect of this that I don't want to go readdressed as well. I have colleagues that work here locally in the pediatric emergency room, and so they are seeing outrageous numbers of children who are, some with COVID, some not, some with other respiratory illnesses. We're seeing a spike in that right now, but we're seeing more than ever a high rate of children who are depressed. Young children who are depressed. Depression is very, very real. And I know this is not a discussion necessarily about children and mental health in the Black and Brown community, but I would be remiss if I did not mention that, because that will be ultimately, I think, a long and maybe even lifetime effect of this vaccine and of these lockdowns and of these mandates and of the deaths that are in families and the sickness that families are undergoing, or that members of family have as a result of this, is that children, they sense stress, they sense disruption in their lives. And quite frankly, I am very, very concerned. We're talking about all the things to keep children safe in their physical body, but mentally, parents should be having discussions with their children, why we are wearing the mask, what is happening in the world. Unfortunately, some of the discussions with younger children about death are maybe happening sooner than we anticipated. And that, as Dr. Sayon showed the numbers about how many more Americans died in 2020 than any previous year. And it's affecting truly everyone. So of all of the things you can do, yes, eating healthy foods, getting exercise as often as possible. Please keep doing those things. Maintaining your regular childhood vaccines, the ones we give right at birth. We give vaccines throughout that first year of life. We give them every 2 months, and these protect children. We do not see side effects. Autism is not a side effect of vaccines. That study was completely disproven. We give vaccines at 4 years old. We give vaccines and they keep children safe. They keep them healthy. They prevent death. They prevent disease. So parents should be doing all of those things, maintaining their childhood vaccination schedule as usual. We need to be eating healthy, emphasizing the healthiness of our diets, maintaining, a very safe and healthy structure for our children. We should, getting plenty of rest, doing all of the things that we know to do that keep children healthy and well anyway. I want to see that more emphasis is continued to be given to the whole child, their mental health, their overall well-being, and it takes all of us. But it's work. It does take parents, being very intentional about it. And I certainly understand we are busy, we are stressed. There is so much going on in the world right now. But our children are the most important to pediatricians, to parents, and I believe to our society.
And so, Dr. Naomi, with that, you mentioned a lot of the mental health symptoms and things. One thing I do notice is that there's fear there, and they don't know how to express that fear. but they know that if they lost a grandmother and auntie to COVID and all of a sudden they're not here anymore, and you're trying to make that explanation to them as to why, and then also join it with the reasons why we're wearing the mask and stuff, there's still that underlying fear that something's going to happen to them and they cannot be protected because they can't get the vaccine that mommy got or something. So we really need to be intentional about protecting them and addressing the fears of all of the losses around them that came from out of nowhere. Uncle Joe was healthy last week and now Uncle Joe is gone.
Right.
So when you start telling them that they died from COVID, then here's the issue. The problem is that now they're deathly afraid of COVID and they have no protections for them. So we need to keep in mind that the fear is a huge problem with them.
You mentioned a great point, with children, when I see parents who bring their children to me to often discuss behavioral issues, it may not be even their physical body, but parents often bring their child and want to talk about tantrums or sleep hygiene or, behavioral issues in school or outbursts or hitting themselves or hitting others. So much of raising children. And I would say one of the number one things and the number one most important thing in terms of raising a child, whether that is your child or someone that is in your custody or you're a guardian of, is that children feel safe. That is the basis and bedrock, I believe, of all parenting. Children have to feel safe. They have to feel protected. And you're absolutely right, Dr. Flalo, that is being violated right now. They have, they're seeing hearing the news, seeing the news, reading it on, they have their own tablets and phones. And this is getting to them, whether it's passively or being told to them, or they're experiencing it themselves. And you're right, that safety, that feeling of security, when that is violated, you have all of the things, the outbursts, the tantrums, the nightmares, the hitting, the biting. So you're absolutely right. This is a continuation of making children feel safe. And making sure they know, you're right, you cannot get vaccinated right now, but I can. Your older brother who's 12, 13, 14, your sister who's in college, she can get vaccinated. Everyone we have around you, as Dr. Sayon said, we're calling any friends you want to hang out with outside of school. We're going to do our best to make sure that everyone in their circle is vaccinated as well. But it's having open dialogue with children, as young as they can, as young as you can, you have to at this point. But thank you for touching on that safety point, because that's very important.
All right, doctors, you guys are, like I said, you're giving out so much information. Things are just blowing up right now. And I want to make sure that we start now getting to some of the question and answers. Dr. Warren, did you want to start off with anything first before we go to some of the question and answers? I have a young lady on also that, so I see your hands and we're going to do some questions, but also have a young lady that we're also going to ask. So Dr. Warren?
Well, I want to thank both doctors for this whole presentation, the emphasis put on the mental health aspect, which is very serious. And I make the observation that, historically, societies and cultures have been about protecting children at all costs. So this is a mutated behavior pattern that we find ourselves in right now. But I am also very much concerned about the fact that we're trying to keep schools open, because that socialization we found over the past 12 months is also an important part of the mental health for children. And so I want to commend you on the pieces that you've given us so far. And I'm hoping as we answer some of the questions that we can go even further, because I'm fascinated by the fact that we are concerned here about masks. And yet I was just watching people in Tennessee before this broadcast who were attacking school board members for trying to require that people wear masks. And it just seems so ridiculous. So I'm hoping that because of the nature of your presentations, that we're going to be touching some minds and hearts and get some change. So Dr. Thompson, you have the listing there. We could go back. We could start with our questions. And I'm sorry, but Dr. Robinson, did you want to get in before we do this?
I just want to make one announcement, and that is on the 18th, just 1 week from today, we're going to be tackling the mental health issues that kids face in school. So we're not leaving that out. In fact, we've devoted a whole program to that.
And that is part 2 to what we're doing tonight. So I'm going to get a chance to remind people that you can come back and we'll really be into that in great detail because this county has been pretty negligent in terms of dealing with the issue of mental health for children or adults. Dr. Thompson.
Well, I want to say that I see the hands and we're going to ask questions, but I have a beautiful young queen princess that is here today. Sweetheart, tell me your name and ask the question.
My name's Rakaya.
Hi, Rakaya. What's your question for the doctors?
Why is it important for children like me to keep your mask on at school?
Okay, she just dropped it on, because we've been seeing everybody say, we need to see they smile. We need this, and everybody's protesting. My question is, she said, why is it important?
Hi, Rakaya, if you're still there, how old are you?
I'm 9 years old.
Oh, yeah, 9. That's good job, girl. Yes, I'm so happy. Thank you so much for your question. That's a great question. So, maybe you've coughed or sneezed at some point in your life. And every time you do that, there's a little bit of spit that comes out of your mouth and out of your body. And your body is trying to get rid of it. There's a reason you're doing that. The problem is sometimes that can get to someone else who's around you, whether it's your classmate or a family member, and that can make them very sick. Your body is doing what it's supposed to do, but it can make someone else sick if you're coughing or sneezing or sometimes even talking. So a mask over your nose and over your mouth really helps protect everyone around you, so that right now, while us adults are doing our very best to fight this virus and to keep you safe, we would like you and your friends and the people around you that while you're in school to wear a mask that covers your mouth and your nose while you're around other people, especially when you're inside. And we really hope this won't be for that much longer, but I really appreciate you asking the question. And I'm so impressed. You sound like you are so smart and that you already do so well in school. So thank you for asking. Do you have any other questions for us?
What about when it's lunchtime? Should you wear your mask at lunch?
Another excellent question. So when you're eating, you do have to take your mask off. So we understand that. Now, I don't know what school you go to or what is surrounding your school. Sometimes some schools are letting children eat outside to help, because it is safer if you're taking your mask off to be outside, or sometimes you may have to sit farther from your classmates because you've taken your mask off, and even talking and eating could maybe make someone else sick around you. So it is okay to take your mask off while you eat and drink at lunchtime, because we still want you to eat and drink healthy things, of course, lots of fruits and vegetables and water, but we want you to put your mask on right after you finish, okay?
Any other questions, young lady? You got one more question?
What about when you're outdoors? Why is it important for students who, like me, are younger than 12 years old to be outdoors as much as possible when you're at school?
Well, because if you're outside, you can probably spread out farther from your classmates. There's wind, there's other things that, if you're inside and you're talking, the virus that we're talking about, that you may be even accidentally spreading to someone else, it could happen more inside, but it doesn't happen as much if you're outside. So hopefully you're outside, you're spread out, you're getting exercise. I love when I hear kids are exercising or playing sports, but if you're outside, things are a little bit safer. So we'd love for you to be outside as much as possible, but still in school every day, eating healthy fruits and vegetables, and doing what it sounds like you're already doing. Sounds like you're whoever lives at home with you, whoever is taking care of you is doing a really good job. So thanks for your questions.
Well, young lady, thank you so much for giving us that. and what I need for you to do is just shout out your school and let everybody know where you go, so they'll know that you're prepared.
I go to Bright Horizon Academy.
Excellent, excellent. Well, thank you so much for coming on. We're going to go to the next question right here. Catherine, what is the next question from the chat?
The next question is, what is the difference between organic immunity, contracting and surviving the virus, and being vaccinated?
Okay, so that's going to go to Dr. Sayon.
Sure. I could start, and Dr. Naomi, Dr. Aflalo, Dr. Robinson, of course, jump in. But there is a difference, right, between natural immunity or organic immunity versus others, versus getting it through the vaccine. And the difference is that the vaccine is the safest way to immunity. We know that with COVID, the infection, you can have long-term effects. You can have that multi-system inflammatory syndrome. You can get hospitalized. Some people will pass away, and you can spread it to others, right? That doesn't happen with the vaccine. Yes, there are some rare but serious side effects, but they are very, very rare. And so, you know, everyone and all the authorities and all the doctors really still overwhelmingly recommend the vaccine. The good news about the vaccine is that there's pretty much the same response, right? So someone as young as a 12-year-old versus someone, an older person, you know, like any of us adults on here, and regardless of race, ethnicity, we generally have the same response to the vaccine. There might be a slight, or there is a slight difference, I'll say, in people who just have weak immune systems, meaning they had an organ transplant or something like that. But in general, everyone kind of has the same response. They have the same level of protection, regardless of age or race, ethnicity. When you get COVID infection, and I'm just gonna pick on my buddies here, Dr. Naomi or Dr. Aflalo or me, if all three of us got infected with COVID, we might have different levels of protection from that infection, right? We will have some level of protection, but it may vary. You know, I may have a lower response than, you know, Dr. Naomi or Dr. Aflalo. So that's not standard. So there was just a study released last week, at the end of last week, by the CDC showing that actually for people who had prior infection, you know, the risk of reinfection is over 2.3 times greater if you're not vaccinated versus if you're vaccinated. So the best thing to do is still get vaccinated. It will only make you more protected against COVID.
Okay, now I'm gonna give some ground rules as we go and start bringing people on from the Zoom. This is a question. This is not a debate or an open discussion. We're gonna ask that when we bring you into the Zoom, that you ask your question to the doctors. All righty, so I am going to go to Vivi.
Thank you all, and valuable contribution to the society here coming on. I have very direct questions. I have a 6-year-old son. We are all talking about 12 and above. And I'm a parent, I'm vaccinated. I feel better now. I have a 6-year-old son. What can be done at that age group, and how long we have to wait that they get some kind of a protection layer as a vaccine form? Number two, when the testings are going on, is there any specific testing for all variants, or we do have different testing methodologies for different variants?
Right. Thank you so much. I'm going to pitch this to Dr. Aflalo.
Why did I know that? Okay, first of all, for your 6-year-old, unfortunately, the vaccines have not been approved yet, even for emergency use response at this point. But the studies are going on right now. We hope that in the next few months, the next level of young adults, meaning the 6 to 11-year-olds, the vaccine will be approved for them, and then your son will be able to get vaccinated. But in the meantime, you're doing all the right things. You're vaccinated, and hopefully everyone around him, 12 and above, are vaccinated. Now, the second part of the question, tell me real quick, because I forgot it already. I'm getting old. What was the second part of your question, which was important?
He's actually on mute, but I'm gonna try to find him again. If he raises his hand again, I'll be able to find him. Okay, I found him. There we go. Your second part of your question, sir, Vivi?
There are testing methodologies there. I have a question regarding too much confusion regarding the variants are coming. day by day and mutations are coming, is there any standard one testing is there for all mutant viruses, or we do have different testing methods there for different variants, and how frequently it is advisable to take a test based on antibodies?
Okay, thank you, Mr. Vivi. I will start off and then Dr. Sion will have more to tell you about the testing. There is one particular test. Obviously, there is a PCR test and an antigen test. The one is more rapid, one takes a little bit more time to process in the lab, but it is one standard test that then can identify if they do special testing after that. After we find out that it's positive, they can test it specifically with other reagents for whether or not it's a particular variant, like the alpha or the delta. So say Dr. Sion can go into that. At this point, my recommendation is that you get tested once a week because you're out there and your goal is to not bring anything into your home. And if you're vaccinated, you still run the risk of picking up the virus out there, not knowing it, and then bringing it home to your 6-year-old child. So I would test at least the minimum if you're out in public and at a workplace and you don't know who's vaccinated, who isn't, I would test at least once a week to keep your household safe. That's my personal recommendation. Dr. Sion?
Yeah, thank you. I think you covered it really well. I don't have anything to add. Really, all tests can identify both of the types of tests that Dr. Flalo mentioned, can identify the variants or can identify COVID infection, but only the molecular, the ones that are processed in the lab, can be further analyzed for whether you had a variant strain or not. But you can pretty much assume if you're getting COVID nowadays, it's very likely to be a variant. It's just which variant it is, and it's most likely to be Delta at this point.
Alrighty. We're going to go to Project Aware. And Project Aware, your question?
Thanks for that. Reginald Washington, Project Aware. I think this question is going to be for Dr. Afalo. Recently, we've had a COVID station here at the Project Aware office in Lemon Grove. And it's one of the main ones where our individuals of Black and Brown persuasion are being able to get tested. Recently, they shut us down that we're no longer to have this as a testing station. It's sort of troubling because we have a lot of our individuals, Black and Brown mostly, trying to get tested. We can't get into those school areas. Do you know why we were shut down in the Lemon Grove area and how we could get back started? And I know, Dr. Fowler, it's one of your testing sites that you brought to here with our help.
Yes, Reginald, thank you for bringing that up. Absolutely. SDSU has been doing the rapid COVID testing at various sites in the community, and we have also contracted with Sweetwater Unified School District. And so what happened was a couple of weeks ago when we started in the Sweetwater School District, we started a few months back, and it was mostly for the athletes and the staff. And then when the school opened up, it became open for all the students. And we noticed an increased surge on positivity, which then meant that everyone in their household needed to come in and get tested. So all the manpower had to move towards the school district, and we had to limit the number of teams that could go out in the community. The goal is we are hiring 2 more teams of people. So if you have qualified people that may have a little bit of background in the health field, then please let me know, because I would let the staff that's doing the screening and hiring know. We're hiring probably another dozen or more community health workers that can do the testing, and then we're going to open back up our community site. So this is a temporary problem. We apologize for that, but we had to shut down quite a few places in the churches and everywhere in the community because we just couldn't handle the load that the 200 at a time each day at the school district when we were handling maybe 70. So the onslaught of the increased testing is what's made us have to redeploy our staff to the schools right now, hire more people and onboard them in about 2 more weeks. We should be able to get you back on board for the testing. It's definitely necessary out there. I'm glad they've been out there a few weeks. They've been in Encanto for forever. And so we're going to continue to serve the community with antigen testing. I'm also going to put some rapid testing. We got 800 Bionex Now antigen testing from the county. Thank you, Dr. Sion, at our Alliance Health Clinic. And all we're doing is training up the staff so we can help with the community load. The demand is extraordinary. So we will get you back, Reginald, in terms of a testing site.
Okay, Dr. Warren.
Dr. Thompson, one of the questions that came up, and I think is so important, we've talked about the shots not being available, the vaccine not available for children under 12, but we haven't touched upon, as one question raised the issue about testing children under 12. because at least that would be helpful to families if they're able to test. Has there been any movement in that direction? Either Dr. Fowler or Dr. Emma, could you address that? Because it would certainly help us.
Absolutely. I'm sorry. I'll start off, but we've been testing children under 12 for a very long time. And they're at all the testing sites. So even at Tubman Chavez and all the antigen testing sites, we have it. So feel free to bring your young children there. I believe it's, what's the cutoff now? 6 months?
Down to 6 months. We've been down to 6 months since like this time last year.
Yeah.
So please help get the word out.
And I see, I have taken care of newborns born to mothers, women who have had COVID, and I've had to test newborns like hours old. So it is not that is hopefully not standard, but yes, we have been testing children. And at this point, I can say here in the clinics, we are just so busy. And I understand schools and preschools and daycares are being extraordinarily careful. It is really made things very hard for us in the pediatrics world. And we understand it. We're rising to the challenge and to the occasion, but any child with sniffles, with even a fever that may be due to something else, we don't know. You can't look at a child and say, oh, this is a cold, or this is the flu, or this is COVID. You can't do that looking at a child. So any child with just a little bit of a runny nose, we're seeing immediately and testing them for COVID. And by the way, testing them for a whole lot of other respiratory viruses as well. And so yes, children under 12, just so you know, we are doing lots of testing of them. But quite frankly, we still, the best thing that could happen is for, we can't avoid the childhood colds. We know that happens. But quite frankly, with Delta variant being so running so rampant right now, we just have to test every and any child that comes in with respiratory illness right now.
Okay. So I'm going to do a little air traffic controlling. I'm going to ask you guys to give your succinct answers at this point because we're overflow with questions. So we're going to go to Facebook. What's the Facebook question?
Can you arm us with best response to help dispel the myth circulating that the vaccine has mRNA that interacts with or alters one's DNA, and therefore long-term dangerous side effects are unknown? They said the best response they've heard so far is if the rumor was true, seems the choice is risking dying versus a survivable side effect.
Sure. I mean, it's just not even scientifically possible. mRNA doesn't even enter the part of the cell called the nucleus, the brain of the cell, where the DNA is. So it just cannot interact with the DNA. I don't know.
All right. I'm going to put Miss Nita in. What is your question? Need you to have your video on also.
Okay, you want to see me?
Yeah, got to see you. There you go. All right.
So I wanted to go back to the question about testing young children. So when I went through the county website, San Diego County website, to find a testing site for my COVID exposed and highly symptomatic 4-year-old, I was told that she needed to see a pediatrician first to then get a recommendation for a test, and that had to be scheduled out. I also went through Rady's, who their COVID hotline is closed on the weekends. So I left a voicemail to be returned a call on Monday, which was 3 days after I called. And then their nurse called me back the next day to tell me to register online to request a test, which then I was called back the next day. Basically, it took a week to get my COVID exposed symptomatic child a test, and she tested positive for COVID. So when I asked everybody, because I'm a very intrusive person, is this policy, is this guidelines? And they said yes, but nobody could tell me where the guidelines came from. So my question, is it county guidelines or CDC or whatever that children under 13, 12 and under have to see a pediatrician first before getting tested? I will mute now.
Thank you.
I can start just from the county side. Nita, thank you for trying. I'm sorry you had a horrible experience. And I will say I am the ordering provider for the county testing site. So I am well aware of the procedures and policies, and that is absolutely not our procedures. I would love to follow up with you offline and get more info so I could provide that feedback and we could make sure that doesn't happen to anyone else.
Okay, your next question.
My 9-year-old daughter is a remission for ALL and B-cell lymphoma. Her ANC is perfect. She will get a vaccine. I am nervous about sending her to in-person learning. Any advice?
I probably wouldn't send her yet until she's fully vaccinated, and then I would continue to keep her masked up. So I would not send her into school yet until 2 weeks after her last vaccination, and then keep a mask on her at all times because she's at high risk.
And I completely agree. Have a good talk with her oncologist. I'm very glad to hear that she's in remission. Have a good talk with your oncologist. And usually a lot of the oncology departments have a team. They have nurses and nutritionists and people around. So have a good conversation with your oncology team, get their advice as well. But I agree with Dr. Flalo.
This next one goes to the pediatrics. There's a lot of shaming of parents who haven't vaxxed their children. How are you combating the psychology behind folks who further distrust medical professionals after being shamed?
This is a difficult question. I certainly don't want any parent to feel shamed. I don't want that. We know that that is not a productive emotion, especially when we are trying to motivate and encourage people to be vaccinated. From a healthcare standpoint, we have seen so much death and so much suffering, far more than someone who is not in medicine. And so it can be very frustrating from our point of view, albeit there's never an excuse for rudeness or to be unkind or mean to a patient. We don't want that. So I'm sorry if parents are feeling true shame. However, the best thing they can do is truly to come to forums like this, to go to their own doctor, and to really just understand that, you know, we are scientists. We know the science. We know what's in these. We are really trying to encourage you to vaccinate and do the right thing. We want you to do it, honestly, before it's too late. And we have your children's health and safety and your health and safety as our priority.
If cases are spiking all over California and the recommendations are for us not to be on indoor gatherings, why are we opening the schools for our younger children?
The question was about why are we opening schools if we're seeing case rates climb? And I'll say again, we opened our doors July 21st to about 37,000 students. We've had less than 150 cases. And while that's quite a number of cases in our schools, and we've notified families following contact tracing protocols and such, it is a small number when you compare it to the 37,000 students. I think one thing we learned in the year and a half where our schools were closed and we were in the beginning throes of this pandemic was really how important in-person learning is for our students, for our community, I mean, for our society. You know, not just the idea of students getting education and being in classrooms, but the idea of families having to work, the idea of kids being able to socialize. And so there are competing ideologies here, and sometimes they confront each other. And one ideology is that we have to have our schools open and have our students in person, and every educator that I know agrees with that. And the other ideology that competes with it is that we have to do it safely. And so you're seeing a clash of that. Yes, there are cases in schools for COVID-19, but with proper mitigation, with masking, with vaccination, with testing, we're able to mitigate the spread of the virus in our schools, but yet still offer a great opportunity for our students to learn and that socialization that we desperately need.
So let me ask you this question, and this is to the doctors. Are we at the time that they might be reconsidering closing schools, or is that not going to happen again, that we feel like we have it more under control and that we're going to be able to keep schools open?
I can start. No, currently there is no state level guidance about, or thought that their schools are going to be closed. Of course, any individual school or any individual district, if there is a lot of cases like doesn't realize I'm here. Like Dr. Morris said, that we are seeing cases, but a lot of those cases are actually being brought in from the community, not necessarily being spread within the school grounds. So it's important to know that, and that schools are doing everything, including also ventilation and things like that, to help prevent the transmission. But if there's a lot of cases, then schools will be contacted and in discussion with county epidemiology. And at some point there could be a policy decision to suggest that schools close for a couple of weeks, and we have to be prepared for that. But I don't see it happening, at least at the statewide or countywide level, anytime soon. Right, Dr. Moore?
Dr. Thompson, can I add in that Dr. Sayon is correct in that, but the one thing I would say is that the decision on whether or not school close is the decision on what the adults do. So if we don't do what we're supposed to do, the schools will close, because we'll have more infections and we'll end up getting our adolescents and our children sick. So if everyone that's eligible, 12 and over, get vaccinated and do all the right things, wear their masks and socially distance and try to avoid gatherings right now, we can keep our schools open. So the decision is left up to us, the adults in the room.
All right, Dr. Robinson.
I just want to chime in. There are examples around the country where school systems have done well. What we have to do is really double down on all the mitigating strategies, the layered mitigating strategies that we have that are in our control in order to control and protect our children. And just to mention a few, I always mention the Archdiocese of Chicago that didn't close their school system when around them in Chicago, the incidence of cases and infectivity was quite high, but yet they were able to stay open. This occurred also in North Carolina, also in Missouri, despite the fact that they got a governor who we don't agree with. It's also been true in Florida, would you believe, in spite of DeSantis, who is anti-science and anti-anything. So it can be done, but my advice is that as parents, we need to build a iron dome around our children. And part of that iron dome is for us to get vaccinated and then follow all the mitigating strategies, the layered mitigating strategies, and we can keep schools open. But it's going to take almost military dedication to get this done, but it can be done.
What's the next question?
We have, when do you expect vaccine approval or authorization for children under 12?
So I could start, and please others chime in. Dr. Fauci and others were saying that late fall, early winter is what we're expecting. That said, the FDA, because of these really rare side effects on the heart called myocarditis, they did ask to increase the sample size so they could just have a more complete picture. They just want to know what's going on. Dr. Robinson is a cardiologist. He can speak to this, but these are really, really rare. And so that may delay some of those studies. I would say probably by the end of the year, but no guarantees.
All right, next question.
What are the benefits of outdoor learning, and why can't school districts do outdoor learning in California or San Diego?
So Dr. Moore, we're going to go to you with this one.
Yeah, so we are exploring all types of learning opportunities. We do have had some classrooms use outdoor spaces. Certainly last year when we were doing small group cohorts, they were in the outdoor spaces. But many of our schools are over 1,000, 1,500, 2,000 students, and there's simply just not conducive outdoor learning spaces for that number of students. So we try to do a mix of things. We I think Dr. Sayoun mentioned ventilation in our rooms, and all of our rooms have the latest HEPA filters and ionized ventilation, and so we really do try to abide by all of the strategies that we know can keep our classrooms safe. And I'm not sure also who said it previous, but what we are noticing is that many of the cases, the majority of cases we are informed of, are folks that are coming into our schools and programs infected from outside, not within our program acquiring COVID-19. And so the masks, the ventilation, the distancing, all of these things, all of these strategies absolutely help with, and again, I'm in a 7 through 12 district, so every one of my students is eligible for vaccination. And so we've held vaccination events, and we strongly encourage that everyone who is medically eligible to get vaccinated do so.
I can go.
Okay, Doctor.
There, just a side comment, and that is what was found last year in 2020. The majority of infections in school came from outside into the school, not from school child to child transmission or from teacher to child transmission. So I think that's a good thing that we've learned, and we can certainly improve on what we've done last year because we have to.
Okay, next question.
As far as cases in schools, what is considered a lot when I know of at least 3 infections since school started a week and a half, but no one is talking about it because it's happening in the South Bay?
All right, we're going to go to Dr. Sayon for this one.
Yeah, I mean, any case, right, is something that we have to be concerned about and we have to address. And so thankfully, the state has come out with good K through 12 guidance for this school year that has really built on everything that we have learned, like Dr. Robinson just said, like Dr. Moore said earlier, right, that we know how to do what we can to prevent cases in the first place, to prevent people from even coming to school if they have symptoms, if they're not feeling well. But then also we know that you can spread COVID and be contagious up to 2 days before you get symptoms, if you get symptoms at all. So, all of these things, like some of these schools in our county are doing routine testing. Dr. Aflalo talked about, right, how her organizations are helping to support that. So, these are good things, and all of these layered interventions are really helping protect spread of COVID amongst the youth, and then really community. So these are important. They are getting reported to us, to the health department. We have a dedicated epidemiology team just for schools. Many of them are former school nurses, and we work hand in hand with the schools. And we also train a lot of schools on how to do testing, specifically to help identify COVID and address it early on.
Okay, so this is for the panel, and listen to this. This is a good question. How are school districts strategizing together? Students from the same home sometimes belong to different districts. So Dr. Moore, anybody can take, but Dr. Moore, since you are our school district representative, are you all talking to one another, or is everybody on their own?
That's a great question. And one is absolutely, we are talking to each other. There's a coordinated effort from the San Diego County Office of Education to ensure that our districts are speaking to one another, and there's a weekly call with superintendents plus weekly calls with others involved with COVID-19 to share strategies. So there is coordination. But I want to say this, we were one of the first. We are a year-round district. We opened in mid-July. The rest of the county isn't opening until later in August. And, so we've kind of been the people who are sharing our best practices with the rest of the, I was on with some folks in Escondido last week, San Diego Unified this week, and others. So we're coordinating, and I believe that folks are looking at the models here in the South Bay and Chula Vista and Sweetwater to see how they're going to ramp up their responses when their schools start later this month.
Wonderful, wonderful.
And sorry, Dr. Thompson, I'll just add to Dr. Moore that from the county side, as we hear about cases, we then contact that family to ask about who was exposed, et cetera. And when we make links, we of course notify other schools if they're not aware that they may have someone who was exposed to COVID, et cetera.
Okay, so here we go. We've had a great conversation, a lot of questions that are being asked, and more questions are going to be asked as we go forth. I want to pitch it over now to Dr. Robinson to kind of just give us a wrap up And then after he does a wrap up, I want to do an informational piece because this the reality is when and how can I get vaccinated? What should be my standard procedure when I do it? Where can I go? Is it still free? All of the good questions. So we're going to be doing that wrap up right after Dr. Robinson. So Dr. Robinson, could you give us a wrap and then we're going to do some finalized questions?
Well, one of the things I want to say, you've heard some great information today, and I want to thank our panelists. This is extremely important. One of the things we have to do is protect our children as best we can. This is our future. And unless we protect them and unless we advocate for them at this time, who will? And certainly we need to then focus on equality and equity in our approach. And let's get a better understanding of what that is so it becomes practical as far as the public health approach to this process. But I want to say in closing, if we as professionals don't advocate to protect our children and actually try to get ahead of this Delta variant, we're going to be lost. And understand, from my perspective, this is a war. And in a war, if you're going to win, then you better get out in front and have a good strategy so that you can prevent some of these things. Acting after it happens is not going to get us to where we want to go. And the other thing I'll mention is that we may lose a generation if we don't do this. In San Diego County, there are 546,000 children under the age of 12, all of whom will not be protected as we go back to school, which many of them will. And so we have to do what we can, and we have to do it well. So that's very important. One of the things to then talk a little bit about, and that is on July 27th, 28th, Dr. Walensky was on television talking about the CDC has changed their guidelines. And that is they recommended for everyone should be wearing a mask, whether you're vaccinated or not vaccinated, indoors. And why was that? Well, the one thing is that this virus has changed. And just to quote a quote from the Mayo Clinic, and that is, don't be deceived because you've got this far and you haven't been infected. This virus is a different virus. It's a game changer and it will find you. So that's very important. Another thing I will emphasize, and having been in the military, I would say I would take a militaristic approach to this as far as families are concerned. I would build an iron dome around and protect my house, okay? Let no one in who has not been vaccinated and wearing a mask so that you can protect your children. Everyone I know wants to protect their children. They would go to the mat to protect their children because that's their primary responsibility. But understand this, the best thing we can do to protect our children is to get vaccinated. I want to mention a couple other things. Remember, this virus has changed everything we know and understand in terms of COVID-19 2020. And I will make an analogy about fast cars. There are a lot of fast cars, but if you have a car that goes from 0 to 60 under 3 seconds, that's a fast car. And if you look at the acceleration of this virus, this Delta variant in the country, it has an acceleration track that we have not seen in any of the spurts that we've seen as far as COVID-19 is concerned in this country. That's very worrisome. And it seeks out everybody. Everybody is an equal person to be infected, and that's what you have to keep in mind. Remember, only 50% of the people in this country have been vaccinated. And in some states that I'll mention, Texas, Florida, Missouri, have 40% of the cases of COVID-19 with the Delta variant in this country, all of which have governors who are making this political rather than it being about the children that they need to protect and their citizens that they need to protect. So in terms of, let's bring it down to San Diego County. what's important here is that only 41% of African Americans have been vaccinated fully in this county, which means it puts their children at risk if they're not. And to my count, that would be in excess of 30,000 children who will be unprotected as we go forward in the future. We need to protect our children. So I will stop with some comments. I may have some comments at the very end, but I just wanted to get those in to set the stage for some of the things we'll say later.
Okay, so first of all, very good questions. For any question, any additional questions, please put them in the comment and we will then read them off and make sure that we answer your final questions. So here we go. We have the doctors are here, the school district is here, the media is here, and the civil rights organizations are all here. We've been doing a really good job getting the word out. Dr. Warren, from the media, what's next and what shall we do to keep the movement moving? Because our Black and brown people are not getting vaccinated at the rate that we need them to.
Well, we're trying to do a couple of things, in particular, the partnership that GOD Radio has with Voice and Viewpoint. First of all, we're running the health ordinances every week that come out from the county. We're taking every opportunity to remind people as trusted messengers that they should be vaccinated. We're doing e-blast. We're putting it on social media. We're speaking of it in terms of Black Men and Women United and all the events that we do. We're doing it here on GOD Radio. So it's been proven that when you keep a matter in front of people long enough, in time they will begin to listen and maybe believe it. This is the same manner that was used years ago for us to learn the songs that became our favorites. We heard it so many times that the words got in our spirit, and then we began to repeat. So we're trying to make this vaccination element become a mantra that people will adjust to. And we are doing this, the paper's doing it in concert with the county and the community itself. People like Dr. Follow and all of the efforts that are out there. We are embracing them wherever we find them. We're putting it in the food distributions every week as we continue to try to remind people of what needs to be done. And we're identifying by zip code in San Diego some of the changes that we have in terms of increases. Like I believe Dr. Robinson, in the past 24 hours, we had 1,500 new cases identified in San Diego, and I believe it was 4 deaths. And at first, before we had this acceleration, we were doing very well. So we got to keep these figures in front of people, let them know that this is real.
Wonderful, wonderful. And so a couple of things are happening. I'm trying to make sure that I unspotlight and get everybody back here. So a couple of questions that are coming up. And this first one is prevention focus on efforts then cure. Not yet vaccinating very young. How we achieve herd immunity, is it a myth or achievable?
No one wants to step up, so I'll step up.
Okay, thank you, sir.
First of all, when we talk about herd immunity, we were talking about perhaps if the vaccine was 94 to 95% effective, then perhaps if we got between 70 and 85% of the country vaccinated, then we would achieve herd immunity. We now know that the Delta variant has put a wrench into that proposition because the vaccine certainly prevent severe disease and death, but people can certainly become infected, and that those people who are infected can also carry the virus and then pass it on to other people. So we have a long way to go as far as developing herd immunity. So we can't say it won't happen. I think we have to keep pushing because we have to do the most important thing that I think we're talking about today, and that is how to save our children.
Dr. Thompson, can I chime in and just say that I tend to focus on community immunity, which means that I'm not worried about the entire herd of the nation right now. I'm focusing on Southeast San Diego. So I rather have community immunity and try to focus on the Black and brown community that I know that I can speak to. and I can make a dent on. I can't take care of everyone in San Diego County, but I can certainly take care of a portion in the 4th district or the 8th district or something. So let's bite off the parts that we can actually chew up and make a difference in. And if everyone takes a street or a block, then we can get our community immunity, and that speaks better for the population we're trying to serve.
All right, next question.
What are the mental health protocols in place to support teachers and students in the classroom?
I'm going to go to the pediatrician, the educator, and the doctors. Dr. Sayon, any one of y'all could jump in on that one.
Well, Dr. Thompson, remember though, before they do, that this is the lead topic totally for next week.
Yes, yes.
So we don't want to use up the remainder of this time on that when this is going to be an in-depth discussion, and the protocol will come up at that point. So we certainly can answer where we are.
Dr. Warren said, to be continued. So you guys can get a little touch, but next week we're going to go all the way in on that mental health. Anybody?
Right. That's a great question, and it's been a huge topic with us, as we've been progressing through. We've identified services with San Diego County. We've got a contract with San Diego County Behavioral Health. We have identified clinicians and therapists, and we are working with our provider for benefits, VIBA, to have some wellness lessons and things for our teachers and our staff. So mental health is not something that's going ignored or unchecked, and especially now. And I look forward to the conversation for part 2 of this, because we are our communities need to grapple with mental health and make sure that those services are available to all.
Thank you, Dr. Moore. Next question.
Is there anything we as parents can do apart from masking to help our children stay healthy when they start school? Vitamins, food, etc. How about us parents? What vitamins do you recommend?
Dr. Naomi, it's coming to you.
I was ready. I get that question a lot. Parents are always asking about vitamins, about Pediasure, about Pedialyte, and about all these supplements. And I understand. We want to make our children as healthy as possible and keep them as healthy as possible. Quite frankly, there is no vitamin, no tablet, no pill that is a substitute for fresh, healthy foods. And I say that to every single parent. We're always looking for a magic bullet that can just make sure our kids are just the healthiest that they can be. But quite frankly, I don't know your child. I don't know every individual child. I want all children to have a pediatrician that they know and trust. And quite frankly, my measurement is always the growth chart. When you go to a child or go to your pediatrician, your child is weighed. We plot every single year, every single visit, where the child is falling on their growth chart. So if your child is gaining weight too quickly or losing weight too quickly, that is a whole different discussion. However, I want to emphasize, most importantly, is being very conscious about food. And certainly, we work in the community. We know that it can be difficult or even more expensive to get fresh, healthy foods. It can be. It is the healthiest thing that you can do for your child. Sometimes it takes a little bit more effort. It means thinking out in advance for the week. What healthy foods are we going to have, rather than saying, oh, we're on our way home from school and work. I'm tired. I didn't plan. Let's go to get some fast food. Every once in a while, that is a treat, every once in a long while, but we have to focus on just good nutrition for our children. There is no specific vitamin that I recommend or supplement for nutrition. It is healthy eating.
Okay, so I'm just going to ask you, I love my child, and they are the joy of my life. If I'm very, very well off, is there a way I can buy the health back? I'm just asking because some people feel like they can buy this health, and there's a secret somewhere that y'all just hiding from us. But if you have enough money, you can buy it. Is that true?
No.
The answer to that is no.
Okay.
No.
Thank you.
You can't even go to outer space and do it.
Yeah. And the reason why I say this is because I want people to understand that this virus, it doesn't discriminate. It don't care if you're rich or poor. It affects everybody equally if you are vulnerable or you put yourself in that position to get that virus. So now we have some people that's like saying, what about the Filipinos and the Asians? Do we have disaggregated data on them? Because are they doing better because they're in Southeast too and in our communities? Oh, they got quiet. Let's see.
No, Dr. Sayon knows the data on we do have disaggregated data on the API community, the African American, the Latinx. So Dr. Sayon can expand on that.
Yeah, so we're limited. I'll be honest. I think there's always room for improvement in terms of the ways we can collect data and do a better job doing that. But we do know that, especially, I know a lot of the AAPI community or a lot of our healthcare workers, particularly our nurses, maybe from AAPI backgrounds, and they have been disproportionately affected, just like other communities of color, right? So, but you can't see that when you're just looking at the Asian group overall. I'm Asian, because my family's from Sri Lanka, even though I was born elsewhere, but I'm of Asian descent. But I'm grouped in, with India, with China, etc. And so it's hard to tell exactly how we are doing as a culture. On our website, we do have some stats, but there are others in the community I know who've been looking at more disaggregated data, but we tend to look at Asians overall. But that's a design flaw that we need to proactively address in the future.
Yeah, and I was corrected. They were saying Filipino specifically. Okay. They want to hear anything about that. And also, if you have any additional data before I ask.
Just that they're at higher risk also for more severe COVID because of the underlying conditions that a lot of Filipinos and Filipinas do unfortunately have. Okay. I did also want to just say that the other thing, I know Dr. Naomi was talking about nutrition. Nutrition is absolutely essential to the immune system. So is sleep, adequate sleep. Many of us don't get enough sleep, and wanted to also emphasize that.
Okay, Dr. Robinson.
One thing to mention, and from population surveys that I've seen, the Filipino population in San Diego County is over 200,000. And yet, in terms of the data, they don't see themselves. And so that's a problem for them, particularly in the South Bay. If you look and see who are the people taking care of folks in the hospital, a large segment of the nursing population is Filipino, and they're being disproportionately affected. So I think that we need to look at that because, if you don't see yourself, you certainly don't know what to think that you should do.
Let me ask you all this. As we are winding up, I'm going to give several marching orders. One, I'm going to, first of all, say thank you all for giving your time tonight. You have been absolutely amazing. We have had almost 200 plus people tuned in tonight on the different formats. So thank you so much for giving your time. I'm going to go in order. I'm going to go to Dr. Robinson to give us a final wrap. Then I'm going to go to Dr. Warren just to give us the set for next week. And then I'm going to give all the doctors, and let me do this again. I'm going to give all the doctors an opportunity to have a final word. Then I'm going to go to Dr. Robinson, Dr. Warren, and who's going to close us out is the president, the woman who is the wind beneath our wings, Miss Francine Maxwell, who keeps us working as a team. And as the NAACP San Diego branch, we're so excited about the direction and the involvement that we have together with our healthcare in this time in this season. So I'm going to start off with one of my favorite people in the world, Dr. Afalo. Final words.
Thank you, Dr. Thompson. I just want to say that I'm going to continue working hard to take care of the community that I love and serve, and you will see me out there. I'm going to have vaccines and testing and anything else that you need. My phone is always ringing off the hook, so I'm available. I'm boots on the ground. Just seek me out. I'm here to take care of you.
All right, Dr. Sayon.
There are systematic reasons why Black and Brown communities have been harder hit from COVID-19, but there is really no reason that we can't catch up, level the playing field really by getting those vaccination rates up. So we have to do everything in our power to do that. of course, as well as testing and identifying early and all the other interventions. So thank you for having us.
Thank you, Dr. Moore. I want to say, Dr. Moore, thank you for being the educator in the room tonight. We go a long ways back, and I appreciate you being here tonight for us.
And of course, thank you. And thank all this entire panel. This has been a high-powered group of folks. All I have to say is that, you know, our schools and schools in the whole county are going to be opening up to your students. And if you have concerns and questions, I think it is extraordinarily important that you dialogue with your school administrators, your district officials, your school boards, and get the answers that you need to your questions. And if anyone has students in the Sweetwater district, please contact me. I'm vernon.moore@sweetwaterschools.org, and we can get you the answers. We're glad to be back, but we are also taking every precaution we can to make sure that our students and staff are safe. And so let us know if you've got questions, because we want to make sure that that folks return to school safely.
Wonderful, wonderful, wonderful. And not last, but you are part of the dual power team, Dr. Naomi Lawrence Reed.
Yes, thank you so much for having me. I echo everything everyone has said, particularly Dr. Aflalo. I hitched my wagon to her early in my career here in San Diego, and she hasn't steered me wrong yet. So thank you for your work in the community. Please, all of the parents, all of the educators, all of the even if any children are still up and listening, you know, we are doing our best. We pediatricians, we love your children. We love them. We want to see them grow old, grow safe. And, you know, vaccines make adults. We want our children to get to adulthood. We want them to thrive and to be healthy and not to have any long-term side effects of a disease that could have been prevented in them. So we're all doing our part. But when you see us, you know, just please know that you trust us with your children and all of their needs and all of their illnesses along the way from the second they're born until they age out when they go to college or beyond. So please trust us now, do your part, get vaccinated. We are happy and so glad to work with you and honored that you do trust us with your children. Thank you.
Thank you so much. And now for our health chair from the NAACP San Diego branch, Dr. Jerome Robinson.
Well, first of all, I want to thank everybody that's been on this panel tonight. It's been very informative. I hope the community also thought it was informative. I take no difference to what Dr. Aflalo says in terms of being a community person. I take both approaches. I'm both global and also local. It wasn't a very few months ago that 400,000 cases of COVID-19 were occurring in India, and we didn't have a Delta variant, and that's where it came from in this country. So I think we have to take a look at the global perspective and then look to see where we are, because this virus got here, and we have to keep that in mind. So again, this is information we try to pass on to you, because I think when you put it in perspective, this is an existential threat to our communities of color, and particularly in Southeast, where Dr. Aflalo is, because we don't know the direction it's going to go. We can see that the slope of the curve is an exponential slope, and this virus is spreading more rapidly than we know. So we have to do things to get in front of it, and programs like this, and hopefully we can do more. And next week we're going to do the mental health aspects of what's happened to our children, but we have to do everything we can to save our children, because they are our future.
Dr. Warren.
Well, first of all, I just want to thank each and every one of our panelists. This has been an extremely important session. A lot of planning went into it. Dr. Robinson worked on it a very long time. And I just want to say out of all respect for the men who are on here, I got to give special credit to the tag team duo. You know, Dr. Aflalo, just every day, 7 days a week, you can find her, and she says boots on the ground. She is everywhere, doing everything. Sometimes you might not recognize her because she got that little cap that she wears and tries to hide underneath it. But even with this recent thing of testing for our young people, would they had to have these exams before going back to school, she was right there on the ground with the sites. And Dr. Reed, I want to thank you so much for the patience and the manner in which you convey to our parents and to our young folks the importance of your position, because most never really understand what a pediatrician is. And then some of our kids, you know, when they get big, 17 or 18, you really think they're adults, but they're still in the category of being under your care. And we have just been so blessed because we know in a couple of states, the children ICUs have run out of beds and space based on what's taking place with this variant. So I know you might not be a panelist, but I hope all of you can come back next week as we follow up on this in great detail, because mental health is one of the big crises in our community. It's not being addressed the way it should be, either for adults or now for our children. And then we have another community here that I've been very concerned about. It's our African communities. And they're having their issues too in terms of getting vaccine in the arms of people. And so those of us are here, we're just working at this nonstop. And too much cannot be said for Ms. Maxwell's effort as a president. This is the first time I know of in the history of the San Diego branch of the NAACP that there's been this level of multiple activities for a community in crisis. And so we really thank you. And I thank you too, Dr. Thompson, for your partnership. And to our educator, we really appreciate you being here. And I hope that San Diego Unified can follow the example that you set tonight. Thank you all.
Well, with that being said, we're going to turn it over to our illustrious president to close us out for the night.
Good evening. Thank you so much, Dr. Thompson and Dr. Warren, and to everyone. Thank you so much. The information, to the parents that took their time, and to the students. The NAACP San Diego branch, we're celebrating 102 years here in San Diego. Our office is located in southeastern San Diego. Our theme this year is Rise to the Challenge, Answer the Call. And tonight, everybody did that. You did that for us, and we really appreciate you. We want to remind everybody to continue to wash your hands, wear your mask, and social distance. And if you can stay away a little bit longer. But one thing we don't want you to stay away from is this coming Friday at 6 p.m. at the Jacobs Amphitheater. The NAACP San Diego branch is having a prayer vigil. It's time to pray, y'all. We are praying for healing and resilience. And so everyone's invited. Please come out. We will have some tables of information so that you can learn about life insurance. We need to prepare our families for generational wealth. We want home ownership. We also want everybody to have life insurance. So once again, the NAACP, we are nothing without you. If you're not a member, please join us. Please become a life member. Go to the website, SanDiegoNAACP.org. And once again, we thank everybody for spending this evening with us. And we look forward to seeing you next Wednesday at 6 p.m.
Well, with that being said, thank you everybody for joining us tonight. And we look forward to seeing you on next weekend or next week. And I'm going to end off with this.
Shout out to the hip hop public health. All the healthcare workers on the front line. Together, we can make a difference.
What's good, y'all? This is Doug E. Fresh coming at you live and direct. All of y'all out there, I got a couple of things I want to talk to y'all about. Wash your hands, everybody. And everybody, wash your hands. 20 seconds. Come on, wash your hands, everybody. And everybody, wash your hands. My people uptown, wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands. That's right.
First and foremost, please listen close. Take your time, wash. Use a lot of soap from the front to the back. back to the front. Sing the hook where you at, that's exactly what we want. If you decide to leave, please take heed. Talking social distance, at least 6 feet. On a bus or the train, riding in your car. The further you're away, then the better off you are. 20 seconds or more. You gotta be able to wash your hands like you never ever washed them before. 20 seconds or more. Try to wait, you'll make the greatest mistake. You need to wash them when you enter the door. 20 seconds or more. Take your time, sing a song, spit a rhyme. When you're finished, you can put on some gloves. 20 seconds or more. It's very important to wash your hands. You're protecting everybody you love.
Wash your hands, everybody. And everybody, wash your hands.
20 seconds
Come on,
or more.
wash your hands, everybody. And everybody, wash your hands.
20
People
seconds
from
or
the
more.
Midwest, wash your hands. Dirty South, wash your hands.
20 seconds
People
or more.
overseas, wash your hands. And everybody, wash your hands.
Now if you catch a little fever, shortness of breath, slight little cough, you can feel it in your chest, you should call your doctor. Doctor know what's best. Don't go running to the hospital cause you could be a threat. The virus is contagious. Listen, they ain't playing. You ain't see the movie, yo, it's kinda like Contagion. Gotta wash hands thoroughly, even sanitize. Open up your eyes, we don't want this thing to rise. Coronavirus.
Don't you get it? Can't you see? We are living in a state of emergency. So wash your hands, save a life. It's only right. And no matter what you're going through, together we can make it right. Come on. Wash your hands, everybody. And everybody, wash your hands.
20 seconds
Come on,
or more.
wash your hands, everybody. And everybody, wash your hands.
20
My
seconds
people
or more.
uptown, wash your hands.
20
People
seconds or
from the
more.
East Coast, wash your hands. People from the West Coast, wash your hands. That's right.